Hi, my name's Rizwana, and so I am doing all my course here in London, except psych. So I have so much to tell you. Obviously, the rotations here are actually really great. They're really nice. It's nothing like you expect it to be. And I've done my rotations in the States as well. So I have a good comparison of how it is back in the States and how it is here in London as well. But what I really would like to tell you is my experience here in London, and let's talk about my OB-GYN rotation, because I'm kind of thinking about going into gynecology, and I mean it's a little different than in America. And the way I can tell you is that because we have midwives here, and midwives here are pretty much, they're the ones that give the normal deliveries of anybody that comes in that's pregnant. These midwives are practically, they're very knowledgeable, and the thing is that you don't always have to stick around a doctor. You can actually go around these midwives. You can gain knowledge from them. You can just gain knowledge from everybody around you, and they're so helpful in certain ways. Like when the person who's pregnant comes in and she's like in labor, she's in her latent phase, and she's not dilated, she's not completely dilated, let's say she's only 2 to 3 centimeters dilated, she's waiting there. She could be up to 20 minutes just to perma gravida, like first time pregnant. And so these ladies, they just sit there with them, and then the whole process is like you go in, and I'm sitting there, and she's telling, and they're so often helping you and teaching you. She's just like, okay, look at this. This is what we're giving her. We're gonna give her oxytocin this way. This is the amount we give her, and then we're gonna increase it on this increment. And the whole process you learn for like a couple of hours. I'm sitting there in the middle of the night, and I didn't have like a moment to like relax, because she just constantly wanted to teach me. And the people who are pregnant are really like, yeah, no, you can stand there, you can watch. After you've seen a few, I mean, they're like, okay, go ahead, try. And you're just like, what? I can give birth. I can help. And they're very helpful, and they love you to like, to help and actually even do it, because they're like, okay, this is a teaching hospital, and this is what you do here. You do the work, and they think they're so grateful because you're doing the work for them. And here you're like, oh my God, you're gonna help me. You're gonna let me do this. And not only that, I assisted in C-sections, and when I mean assisted, I didn't mean I was standing there and holding the skin or the flap. I was actually like, okay, holding the uterus. I was actually like, holding the stitches, putting things in, and it was like, okay, you're actually up there, you're scrubbed in, you're so close up. You don't really get the experience. You get to see all the anatomical features. And it's by far the best experience I've had. It's not like you're in the States and you're doing grub work. I mean, grub work, yeah, you can do it here as well, to learn how to draw bloods, do ABGs, venous punctures, femoral punctures, whatever there is, you do it here. You do everything. LPs, like, everybody is so willing to teach you. But here, like, they actually, they feel guilty not teaching you. And that's the funny thing, is that I feel so surprised when they're like, oh, I'm so sorry, I didn't get a chance to teach you today. And I'm like, are you apologizing to a medical student? And you don't see that here. Like, you don't see that in the States. No resident is ever going to apologize to you for not teaching you that day. So it's great. You get teachings every day, maybe even 2-3 teachings on certain topics, and then they even like test you on your practical, like, okay, let me see you do abdominal exam on this patient, okay, and then the physical, and then when they check your physical, they're actually like, okay, are you doing it properly? And they sit down with you, like, what signs are you looking for? I mean, you don't get that in the States. When you go in there, when I started in the States, when you go there, they're like, okay, go do the physical exam, come back, tell me what you find. You could be doing the physical exam completely wrong, and you could just say, I don't know, made up of like the physical exam. You never know, and the resident will never know. But here they check, they check to see if you're doing it right. They check to tell you, okay, you're gonna get examined on this. This is how you should be doing it properly. This is what you should be checking for. This is why you're checking for it. So a lot of these things matter here, and I feel that education and knowledge that I've gained here is a lot more than I probably would have gained in the States. But but I'm saying this because I've actually done rotations in the States, and I've done rotations here as well, and I probably would choose this over the States many times. So yeah, come to London if you really like. If not, then that's your choice. But if you want to get a good solid knowledge base of being a good doctor, I think this would be probably one of the best decisions that you can make. And plus, you're in London. I mean, there's really nothing more to say. I mean, why would you not want to be here?